Well, hello, everybody. Again, we have a visitor coming back with us is Tony Remington, CEO of Gravity Diagnostics. Tony, thanks for giving me your time today, as always.
Thank you. Thanks for having us.
Well, we've spoken a couple of times about your great organization here in Covington and its expansion in the testing world and dealing with this. But for those who maybe haven't seen this before, tell us what is Gravity and what is your main purpose in dealing with COVID today?
Sure. We're Gravity Diagnostics is a CLIA laboratory licensed in all 50 states. We're headquartered in Covington, Kentucky. That's where we do all of our testing still today. Before COVID, we were doing other types of diagnostic testing, toxicology, upper respiratory testing, pharmacogenetics, and things like that. Very small private company, trying to will our way to success. I've been around for over 4 years. We were lucky enough to have one of our PhDs, who's brilliant, JP Kanner, approach us at the end of last year about validating the COVID-19 testing when it was over in Asia. And we made the decision to embrace that and do it without really knowing, obviously, that it would have such an impact. So kudos to him. And then when the outbreak hit the United States, kind of the Gravity way, and our relationship is a part of that. For 4.5 years, we were always turn over a rock, taking every meeting, trying to partner with the city, the state, the county, academia, do workforce incubators for college students, and work with the government. We're really passionate about opiate addiction and how can we help with that because of our toxicology testing. So when COVID hit, we really took a step back and tried to make sure we embraced those that were most in need of rapid turnaround time with PCR testing. That led to a quick partnership with St. Elizabeth Healthcare, which then led to a partnership with the state of Kentucky, working with Dr. Stack to do those most in need of testing, hospitals, nursing homes, county health departments, prisons, et cetera. That was back in the end of March. And since then, we've gone from, we had some employees outside of this area, sales personnel and clinical support type people, but in the Covington office, we had about 35 employees. Today, I think we're over 400 people. So a lot of that is, we have a great temp agency partner that's filled in the gaps for us in a lot of ways, but we probably have about 300 full-time employees now in Covington. We've gone from about 5,000 square feet to over 50,000 square feet of build out space. We have 2 laboratories, 2 different locations. And so, just finding parking, and you were great helping us out with that. You can imagine that influx of just parking and break space and, facilities and amenities. It's been a fast pace. And then I just want to mention the testing itself. We went from about less than 20 or so COVID tests our first day of testing. Our highest number so far in one day is 26,000 samples in one day. Yesterday, we got 23,000 samples. So Tuesday tends to be the biggest day because Monday, the nursing homes are testing their employees and things like that.
So this is an important fact. I mean, you've got this unbelievable growth of your company. You got involved in this early, and a huge benefit, St. Elizabeth, the state working with you all. We have this right here in our community. So when we're getting testing, not all testing done locally is going through you all, but
right.
Drive-through testing, for example, as you pointed out, is coming through your facility there. What does that mean to us as a community and as a resident in Northern Kentucky?
Yeah, no, thanks for asking. I mean, first of all, I say this all the time. We had no idea the positive impact this would have on our business. So obviously it's, allowed us to scale and grow, and it will make us sustainable post-COVID as well. But in the beginning, we're really proud of our approach. And the reason I think our culture has been stayed intact and done so well is because we always put the patient first. We really saw the ICUs filling up. We saw the turnaround time with the big national labs, up to 5, 6, 7, 10 days. And we saw the nursing homes, have some outbreaks, and really realized that quick turnaround time could really save a life. And I think that not only helped the community, but it really helped our employees and their morale. And we're open 7 days a week now, and we're really going towards like a 24/7 full-time operation. And so to your point, Kris, I think having couriers be able to deliver samples daily, where you can have a sample done up at the drive-through today in St. E's and we get it this afternoon, that does allow for rapid turnaround time, where if that goes out west or to the East Coast, not only do they tend to have a longer turnaround time than we do in general, but you're just adding time. And we also are lucky to have UPS. The World Airport is in Louisville, so that really helps. We get samples delivered at 4:30 a.m. every day. So even if you were a smaller institution in this area and you use UPS, we're going to get that at 4:30 the next morning instead of, noon or, in that afternoon. So, I think in really, no one's going to, be able to keep up with this probably unless this is what they do every day. But PCR is really the gold standard, and that's the type of testing we're doing. So if you can get that 4-hour turnaround time or same day turnaround time or next day turnaround time, it has a ton of value for that patient and, that clinician. So.
And kudos to your all's team, and then really the partnership, the state, and of course our healthcare facility here at C&E has been great. Yeah. I've heard some friends around the parts of the country who've not been so lucky and fortunate. But let's talk about the testing as we're here in December now. Yeah. The vaccines are days possibly away from being deployed. Maybe talk to you about what does that mean in terms of your future with testing, and obviously maybe speak to also the question of, people have heard say, well, it's all this testing. Why would we want to keep on testing people? Why would you want to be able to go if you're not symptomatic and get this test?
Yeah, no, and again, I'm number one. I'm not a PhD. I'm not an MD, and I'm also not. I'm very open-minded to politics and opinions, and I try to stay out of all that. I think that, from my perspective, what I've seen, I try to keep up with the news and talk to government officials and clinicians and people that are in the trenches. And, we just read a story the other day about a nursing home employee that got COVID at a wedding and had, an outbreak at the nursing home. And I think like 6 or 7 of those patients passed away. It's getting to a place now where, I've literally had, my brother-in-law, one of his best friends, my age, my health, pass away. We've had 2 employees here lose a grandparent last week. I mean, it's hard to say that the PCR testing doesn't make an impact, right? I mean, from my point of view, if you're young and healthy, it's tempting to let, just look the other way and not, do your part. But I feel like that young and healthy person is more likely to do something over the weekend that could then impact someone else that doesn't have the health and the resistance to it that we do. We actually have a really young, healthy employee that got COVID, and, she was like, it was the worst 3 days of my life. So even if, you get through it, it's still not something that anyone would welcome on anybody. So I think, has it been done most efficiently and perfectly and synergistically? Probably not. Sure. Could we have maximized the capacity nationally in a better way? I'm sure there's a ton of lessons learned there, but, even with the vaccines coming out, I would just caution everyone that, it's going to be a process. It's going to be, the first one has to be refrigerated. There's 2 different doses. Someone's got to go into these nursing homes and do that implementation of the vaccines. I'm sure St. E's will have a role in that. I think CVS and Walgreens are doing something nationally there. So you're looking at probably another 90 to 120 days just to get the most in need, the vaccine, right? And so people like us probably don't get that vaccine in the next, 3 months. And then you're going to have, a rate of people that it doesn't, work as well as it should. You're going to have people that don't want to do the second dose. I'm just mentioning it to say logistically, we all got to stay diligent, but I'm excited that it's coming, and I'm excited that we're going to get through this. And we all are looking forward to the day when we can go back to ball games and, back to normal. So I'm excited about it. I'm positive about it. I know it's going to, we're going to get through this, and COVID's going to, be very, very limited a year from now, but we still got some work to do. So
the benefit of the drive-through testing, et cetera, but after this next couple of months, let's say it's not available for free through drive-through, the same kind of testing, we would feel like we were going to probably have this available through our doctors, correct?
Yeah. One thing that's really important is we do other types of upper respiratory testing. So a year ago, 2 years ago, there's other, I'm going to call, say, pathogens that when you feel sick, you might have. So I'm sure you feel this way. Everyone I know, including myself, thinks we got COVID, right? But there's other types of, flu-like, pathogens or what. I always use, my PhD team makes fun of me when I try to get clinical, but the point is you could get sick and not have COVID, right? So all of that testing we do is going to be more prevalent than ever, more important than ever, right? So this flu season will probably be really busy in terms of other types of illness. And then, when the dust settles, hopefully next flu season, I still think if you get sick or you have a temperature of 102, you're going to want to include the COVID test in there to make sure that, you don't have COVID, even though if you got the vaccine or, et cetera. So yeah, I can see this going to the primary care setting. I can see it going to more of that setting. As of today, the insurance and the payers have been great at supporting the right testing. And so I see that kind of transitioning away from the government programs and more towards the patient's responsibility.
If I'm actually feeling ill today and I go through the drive-through I'm tested for COVID, if I only had, let's say, the traditional flu,
Mhm.
would that come back in that diagnosis? Would it tell me, no, you've got,
No,
what would be the message I would get back in my
you would just get negative for COVID-19. So it's a really good question. And to the world out there, it seems like obvious that we should do all the pathogens all the time, right? Hey, if you're sick, we'll tell you what you have while you test for COVID. It's a little more complicated than that. It takes more time to run it. The payers are going to be more restrictive on that, want you to have the right medical necessity. There's some behind the scene reasons the timing is probably not right for that, but we do see that transition, Kris, where when the capacity's there, when the turnaround time nationally is in check, where everyone's getting what they need on time, you would, that would make sense, right? I mean, hey, I don't feel well, it's real. If I don't have COVID, what do I have, right? So yeah, we think that will be more prevalent testing down the road, and we're building a plan around that. And that's really 2 years ago why we were positioned for this. We were already doing that testing. We already saw value. We already had 100 customers that ordered that testing from us. So it's a good question though. I mean, sometimes I get you want to make it perfect, but there's some good reason behind why we can't do it all every time.
Yeah, so you could have someone literally drive through, get this saying, hey, I don't have COVID. I still feel terrible. I know I'm sick. Well, okay, I might be going home and get through whatever it is, a flu or whatnot, but it's not COVID.
Right, exactly.
Well, I guess the other point we'd make, and you built this couple hundred team member here in Covington, and they're working hard. You've had lots of takeaways from this experience over this past year for sure. In terms of your team, speak to your team, how that's going, and then maybe any message to the community if you had to look out here over the Christmas time frame as we're getting Christmas. Any thought and insight offers?
Thanks for asking. I every time I talk to anyone, I mean, there was an article, I think it was in the New York Times last week or this week about the burnout in the lab, industry right now, the lab personnel, the medical professionals. The team at Gravity and all these lab employees nationally, the work they put in, the effort they put in, the countless events they've missed. I mean, we were open on Thanksgiving with a limited crew. We were, we had to get all the samples out that Wednesday before Thanksgiving. People were here till 2 a.m. We worked that Friday, Saturday, Sunday. We built a team where we're trying to stagger their shifts and give people breaks and keep that going. But there's a legitimate burnout of just getting up every day for the last 8-9 months. And the thing about COVID, every day, the most important thing, like you can't wait a week. If someone didn't get a result, if someone's looking for a patient result, it's now. So that mentality, even if you get time off, you're still getting a text on a Saturday or an email on a Sunday. So I just have to say the Gravity Diagnostic team has been amazing. I mean, it's the most emotional, touching thing I've ever seen in my career in terms of people coming together, putting others before themselves. I mean, we did a round of interviews recently to hire, promote some people within. And, we had, one of our current employees was like, I come in at 4:30, but sometimes I come in at 2 because I just can't sleep. And I know I can get in there and help somebody. And it's just been, and honestly, I say this a lot too, like this area, I'm not from Covington, Kentucky or Northern Kentucky. I mean, the area's embraced us and we feel a part of it, but the community and the people here are amazing. I mean, it's a pay it forward culture. It's put others before yourself. I mean, you've done things, St. E's has, CTI, Chuck Shepherd. I mean, the list goes on of just people helping each other. So I give our employees all the credit because, humbly, there's other labs that do more volume. There's other labs that had more capacity, more robotics, more this, more that, than us. But during COVID, there's no lab that in this country that did what we've done. So it all is about the people, and this community is really all it's about. It's important.
Well, as you look forward to this, the vaccines and hopefully the end or close to end of COVID in 2021, any other message to the Northern Kentucky community in terms of, getting through this, messaging about, getting to the end of COVID?
Yeah, in the beginning, I remember it's giving me the chills because I remember saying, make sure you, order from the local restaurant and, keep the economy going. I remember saying that probably back in April. I mean, I do think it's important that, we've tried to we do free food trucks on Friday, and, we try to do things locally to kind of help each other out. And I think my message would be, try to help anyone you can in this area kind of get back to normal, whether it's, ordering food or the dry cleaners or, whatever. I just think everyone's been hit pretty hard from an economic point of view. So that would be my kind of message, is like, we got to do this together. We got to stay in it together and get out of it together,
Well said. And it's a great message to end on. Tony, thanks for your time and your team's time and effort. We wouldn't be where we are in Northern Kentucky probably without that effort. So we appreciate it.
Thank you. Thanks for your help. Take care. Have a good day.